Welcome to our special session of Leaders Who Care, but artificial intelligence, healthcare, special company called Digital Diagnostics, and I'm so happy to have you guys here. I think the best way to start would be, let me introduce my co-host real quick, one of my favorite partners. I did say one, so in case the other partners are listening. Ed Martin, welcome, Ed.
Yeah, well, thanks. Thanks for being one of the favorite. I'm going to let them know and tell them later on tomorrow. So, great to be here. And Mark, you really know some incredible people. You got some real heavyweights on today and really powerful folks in the tech space and the health space. So I'm looking forward to being a part of the conversation.
Awesome. So let's get started. If we can, you guys can just give some brief introduction about your background, who you are, and then we'll start chatting. So how about if we start with, I'm going to go the way I see it, like Brady Bunch. Dr. Michael, how about you first?
Hey, thanks so much, and very excited to be here. My name is Michael Abramoff. The accent is from the Netherlands. I came here to Iowa 17 years ago. I'm a neuroscientist, a computer engineer, and a ophthalmologist, a retina specialist. The reason I'm wearing this mask is actually because I'm in clinic today, so after this I will go back to patients. I'm founder and executive chairman of Digital Diagnostics, formerly IDX, and we created the first ever autonomous AI cleared by FDA, meaning it is an artificial intelligence that makes a medical diagnosis without any human oversight.
Cool, thanks. Robert, Dr. Robert, how about you?
Sure, thanks very much. I'm Dr. Robert Levine. I'm professionally trained as a cardiologist, but left the practice of cardiology in 1988 in order to join my wife, Mary Tyler Moore, in her efforts to raise awareness about the devastating consequences of diabetes complications, in particular type 1 diabetes, affects even the youngest children, and support efforts to find a cure. Mary had been diagnosed with type 1 diabetes in 1970, and by the time we met in 1982, it already developed significant diabetes-related complications, including retina disease. In 1983, the Juvenile Diabetes Research Foundation, the JDRF, asked her to become its international chairman, and she accepted. A little bit more about my background. Out of the work that I did with Mary and the JDRF came an opportunity for me to help lead building a 50-state grassroots advocacy capability for the JDRF, organizing families personally affected by diabetes, advocate for federal funding for diabetes research.
This is supposed to be a serious discussion, but I got to tell you, Mary Tyler Moore and you have created a legacy even beyond when she did entertainment and what she did for nonprofits, and I'm just proud to be here and be part of it. I just wanted to let you know that from my perspective. But save some of that because I want to get Stephen to introduce himself too, please, and then we'll really get into it. Stephen.
Hey, I'm really jazzed to be here. Let's have some fun. I'm Stephen Ibaraki. I'm chairman and general partner of Reds Capital. We invest in transformational tech, scale globally. I'm also founder for AI for Good, which is being adopted by like 1 billion plus around the world. And I'm also founder of a CEO conference and a think tank for Fortune CEOs managing almost 100 trillion in assets under management. And I also work across computing science communities, like one called the ACM, the IEEE, and IFIP. And I work across UN agencies, for example, the World Food Program, which is the world's largest humanitarian program. And I'm just going to go ...
And you should see what he does in his 2 minutes of spare time, actually. And I'm actually proud to sit on the board of Million Peacemakers, which is about a signature program called Nonflict with Stephen, and he's done some great stuff there too. So, hey Ed, can you give a tiny bit about your background, and then maybe let's get into a little bit with Robert and Michael about how this all began and what it's really about.
Sure. Yeah. Thanks, Mark. Yeah. So a couple of things just real quickly. I'm mainly a corporate guy. So I was at the Kellogg Company and Citigroup and Ford Motor Company and a number of others, including the Hershey Company. And I actually met Robert when I was at the Hershey Company. I was one of the guys who was wandering around the world and eating and selling chocolate and candy. So pretty good job there. And I remember getting a call from folks who were really leading in the tech space in terms of NFC. So how do you merge the online world and the offline world? And one of the top, really one of the top leaders in that space in terms of the creation of the IP and the technology was our very own Dr. Robert Levine on the call here on the podcast today. And so I said, well, wait a minute, aren't you like a famous cardiologist sort of person who's doing incredible work with diabetes and things like that? He's like, yeah, no, I'm doing that, but I'm also doing this. And he's one of those folks too who are sort of the Renaissance man, I suppose. So he came into the Hershey company and shared with us, he said, what would it look like if you could walk into a store and share a kiss with a phone? You sort of take your phone out and you tap it someplace and all of a sudden you could actually share a kiss. I'm like, wow, that's pretty cool. That's pretty interesting. And so then it became sort of the journey with, got to know Robert more at a personal level as well as beyond his tech stuff, and really understood how he was trying to arc everything towards good. So technology for good, AI for good, everything he was doing was heading towards that space. And over the years, we stayed close. And one day he had called me up, and of course I knew about the moonshot in terms of what he'll share a little bit about that in terms of how do you help people who are dealing with diabetes and not go blind when they really don't have to, if you can catch it early. And he told me about a remarkable doctor that he knew about, one of our other panelists here today. And he said, well, they are looking at trying to drive access and health justice in the world to get this into the retail environment. All the big CVS's and Walmarts and Walgreens and all these stores where people normally will congregate, but oftentimes don't have access to, different kinds of healthcare. And once I talked to Dr. Michael over here, I thought, oh my goodness, this guy is a rock star as well. And so the journey began as well. So it really came in with personal relationship over the years, Mark, as it often does, and just understanding the deep intention of what he was trying to do. And they just happen to be best in the world on the technology side as well. And I'm excited. So I'm looking forward to getting into the conversation and sharing with a broader group now that we're sharing this podcast too, in terms of what digital diagnostics is now doing in the world.
So maybe we can get a little thing going between you, Robert, and Michael initially is, how did that come together? And talk a little bit about, this is personal. It's about humans. It's about healthcare. How did that come about? And then Michael, talk a little bit about the purpose for founding the company and what that looks like. So, Robert.
Mark, thanks. That's great. Let me just go over the founding of the Moonshot, if you will, and kind of the deep, the personal story that really was the motivator, for it. And so the purpose of the Restoring Vision Moonshot really is to help make Mary's vision of a world without diabetes and its complications real, and honor her contributions to diabetes research and care. So we hope to achieve that by bringing together scientific leadership from diverse backgrounds and adding the patient voice to the process. This purpose, of course, is important broadly from a global perspective because first, diabetic retinopathy is the #1 cause of blindness in working age adults here in the U.S. And in particular that it disproportionately impacts minority populations. And more broadly on a global basis, there are about 145 million people today globally who have diabetic retinopathy, projected to go to over 220 million by 2040. And there are about 50 million people today who have vision-threatening retinopathy in the world, projected to go to about 70 million worldwide, over that same period of time. So it's definitely a global issue, a concern. It's specifically a big concern here in the United States, and as Ed mentioned, disproportionately affecting minority populations as well. But from the personal perspective, I'd like to just render a little bit of a story about Mary that maybe some people don't know. And Ed, I think it's fair, if you'll allow, Mark, please stop me if I get too long-winded on this, but it's fair, I think, for people, who know Mary as an actress or maybe even as a diabetes research advocate, but but there's something they may not know about her. But in her heart, she really thought of herself as a dancer. And she worshiped Fred Astaire and Gene Kelly and Ginger Rogers and Sid Charisse, and really wished that she could dance like them. You know, everyone who knows her or knows anything about her knows she was highly disciplined like a dancer and had a strong work ethic and a drive to perfection and a willingness to take risk. And she clearly understood that what she was doing could, you know, create bloody toes. But nonetheless, it was in dance that Mary found her true. And this is the personal part of the story. Mary's diabetes stole this joy from her. I mean, she was able to manage through numbness and the loss of position sense due to her diabetic neuropathy. She was even able to train herself overcome the exertional pain of her peripheral vascular disease due to diabetes, and ultimately had to have surgery, you know, to get further relief. But what she was never able to overcome was the vision-stealing impact of her diabetic retinopathy and the severe narrowing of her visual fields and diminished night vision that accompanied the laser therapy she had received treatment for it. So it became a challenge over time for her to simply walk across a room to avoid obstacles or judge changes in grades or walk downstairs or be physically active in low light, making a once fiercely independent woman, you know, a joyful dancer, unable to get around on her own, unable to sustain her autonomy. This obviously had significant effects on her ability to work and her quality of life. So you know, Mary was JDRF's international chairman for 30 years, and even though there was a lot of research progress in that time, the ultimate goal of finding a cure for diabetes and complications was not achieved. And so following Mary's death, you know, when I discussed with the JDRF leadership what we might do to best honor Mary and carry on her quest, it seemed fitting that we choose an initiative to help restore vision and prevent its loss in diabetes. We called it the Restoring Vision Moonshot, and in kind of doing so, we hope to capture the intentionality of the original Apollo moonshot. So when we organized, we had two, you know, we tried to look at it from the perspective of people with diabetes. So what's the perspective of a family or an individual with diabetes? It's about the vision that has been lost, the disease they're suffering from, and how it's caused a disability in their lives. But it's also the vision that will be lost despite the therapies that are available. And that's where the focus on AI and Dr. Abramoff's work comes in. So, because if you look at preventing visual loss, one necessary first step is to identify who in the population is at highest risk for that loss. And to accomplish that requires a means to do large-scale screenings of people with and at risk for diabetes for evidence of retinopathy.
So there's a great segue.
Right.
Great segue. Right. I'm a great interrupter, in case you hadn't noticed. There's a great segue. And I will tell you, I got to say it again, because I grew up watching Mary Tyler Moore, and vision seems to be the right word for her, because she was visionary as a female in a male-dominated industry. She should have told Dick Van Dyke how to not trip over that ottoman by that time. That's another story. And she was a vision in a lead role in key parts, but also in the world. And it's continuing, and I got to give you kudos for continuing her legacy and vision into what you're doing here. It's really inspiring, and that then kind of segues to you, Dr. Michael. I hope you still weren't working on a patient when you came in here, because they're going to be waiting a little bit. But can you talk about how you got engaged with Robert, and what your purpose was, and why you thought it was exciting, and what you're doing now, and about the ethics and all the stuff that goes with it?
So how I met Robert was, I mentioned I'm a neuroscientist. I've been doing AI for a long time, for maybe 20 years. I've been doing neuroscience for 30 years, doing neural networks mimicking the brain in Japan for 30 years ago. Went on to eventually go back to practicing medicine. But meanwhile, I'd been a computer engineer building software. And one of the things I did was better measure parts of the retina. And that helped me and my team discover that neural damage is very important in diabetic retinopathy. So Robert already mentioned, diabetic retinopathy is very much a vascular complication of diabetes, but there's also a neural component And we usually don't talk about it much for the last 150 years. And so the research I did showed that it was important, that it allows new preventative and curative, meaning treatments, to be discovered and figured out. And so that led me to meet Robert and his awesome Moonshot initiative. Meanwhile, I had been on a separate side, I'd been working on this preventative artificial intelligence to actually make a diagnosis, which was totally not related to why I think I was invited by Robert, because it was really about the science and discovering new treatments. But there was, aside from that, the preventative part where what you want to do is bring the diagnostic expertise of someone like me, a retina specialist, anywhere where the patients are, which is like Ed already mentioned, in retail, in the Walmart where they do the shopping, maybe in the Walgreens where they get the script for their diabetes. And so I was working on that at the same time, and we talked about it, and that's where it really started. And the way I look at it, why I was doing that, I'd been working on AI for decades, became a resident in ophthalmology, did my fellowship in retina. And during the time, I was seeing a lot of patients with diabetes who have nothing wrong with them. They don't have diabetic retinopathy. And it's important to know, like Robert said, you need to diagnose it early. Otherwise, in a later stage where people have symptoms, there's permanent damage. It's really hard to then treat it for a full recovery of vision. So you need to diagnose it before they have symptoms. And I had multiple patients who came too late. So I had patients who didn't have anything wrong with them, and I was spending a lot of time on it. And I didn't have enough time for patients who actually had irreversible damage to treat them as well as we could. And one of them was a painter, and it was a very sad story because this painter was a bit elderly, had diabetes for years. And he came the first time in my waiting room, and I saw him sitting out there, and it was a long waiting room. You had to wait 2 hours to see me. So he was doodling on a pad, making some images, and we talked when he came in, and we talked about what he was drawing, and it was okay. It was interesting, but it was not, it was not Matisse or Van Gogh or whatever. And he showed me some of his earlier work that he carried around, and it was just very different. And we started talking, and it was because he had lost so much vision, and he wasn't aware that it was because of the diabetic retinopathy. So he really came in too late. We did what we could, but at the time, laser, which damages to prevent more loss. But part of the vision loss was irreversible. And that was just a terrible experience for me, even worse for the patient, obviously, for the painter. But, you could never paint as well as you could before. But for me, it was, wow, we really need to start using a better way of diagnosing this disease early. And there's a lot of discussion has been about why people don't go, and copay is part of it. But the biggest reason is really access, like Ed already mentioned. You need to bring it to the patient rather than have the patient make an appointment, travel, sit in the waiting room for half a day like they're doing right now, to maybe see me for 5 minutes and usually get told everything is okay, come back in a year. And people eventually don't do that. So if you make it available really easily where they get a diabetes management or where they get a script, that's what we need. So given my background in computer engineering and AI, I decided, okay, let's build a AI that actually can make a diagnosis by itself. Because typically at the time, the research in AI was very much about, how can we make the doctor better? Assistive AI, I call it. It's not replacing the doctor where in this very specific task, in a very cognitive, difficult, challenging task. It was all about assisting the doctor. And if you want to bring this to retail, it needs to be autonomous. It needs to make the diagnosis by itself. And that's challenging from a patient perspective. And now you get into all the ethics you mentioned. So since you want to interrupt me, I think I will stop here and see where we go next. But yeah, the next I want to talk about is ethics.
I like that. Somebody who preempting my preempt or something. I'm not sure. So great segue then to you, Stephen. AI for Good. What a crazy title that you created that big summit. With all you've heard and what you've learned from meeting Robert and Michael and all that you're doing, let's start first with your thoughts about how this is AI for Good.
Yeah, it's an incredible synergy with AI for Good. I mean, AI for Good is really about demonstrated solutions to fit the United Nations 17 Sustainable Development Goals, one of which is better health worldwide and making it accessible to everybody on the planet, whether it's developed or developing regions of the world. So definitely digital diagnostics fits that. Robert's works fits all of that, making it accessible. And what better way than to amplify it using AI, embedded in different devices. Your phone has AI embedded in it, and then amplifying that with the kind of technologies that have been mentioned here. And you could be in Asia, Africa, North America, Europe, it doesn't matter. That's what AI for Good is all about. And that's why it's being adopted by governments, by companies like Microsoft, for example, and even research groups like Mila out of Montreal. They all have these AI for Good programs. So definitely a lot of alignment, and definitely this ability to scale globally. Definitely ties into diversity and inclusion and equal access worldwide. And for healthcare, you know, healthcare is roughly maybe a $9 trillion marketplace worldwide. And if you can have this accessibility, then everybody can do it, right? So, and that's autonomous aspect. The more that you can automate and you don't require a lot of, you know, deep healthcare professional intervention, but you can get people to do it at home and so on, even better still. And if you can get it through the retail marketplace, marketplaces, wow, what's better than that? And then keep in mind, we're in the midst of a digital transformation globally. And what the pandemic has done is accelerated that. So I'm talking the use of 5G and artificial intelligence, robotics technology, and data analytics, and what they call the cloud technology, and telemedicine. All of that being compressed, something that people were predicting was going to be rolling out in 10 years is now happening today. And the examples through Robert and Michael are prime examples of that compression happening, where it's accessible today to everybody. And then, of course, it ties into this element of ESG, you know, environmental, social governance issues, and the importance of having social impact that's sustainable, and it fits all stakeholders worldwide.
You know, it reminds me a little bit of, and we'll get into some of the other things they're doing too, about, you know, you send a spaceship up to NASA to do this, but 14 other things are invented because of it, and things happen like that. And I'm sure you've seen that with all the innovations that you've seen, Stephen, that A leads to B, leads to C, leads to X, and it's amazing, right?
Yes, absolutely. It's all connected, by the way. And I guess it ties into this, you know, fourth industrial revolution came out in 2016, became Society 5.0 about a year and a half ago. And that's all of this compression happened, and it's all interconnected in some ways. Absolutely correct.
We actually started talking about where the Fifth Element name came from, the Fifth Industrial Revolution. I didn't even have to ask him that. Hey, between Ed and Robert and Michael, could you talk a little bit about how this all works, and in terms of actually doing the test, in terms of ethics, as you mentioned, you know, Michael, in terms of education, you know, about what this is about, because diabetes is paramount in underserved areas. So maybe we'll go back to where we came from with Michael. Maybe you can talk a little bit about that, and Ed and Robert, you know, chime in.
Yeah, so to make sure that you understand it's real, I mean, it's literally in supermarkets in Delaware. What it is a tabletop device that allows, it's not for the patient themselves. It's currently too difficult for the patient themselves to do it, but it allows any retail staffer, anyone with a high school graduation, to take high quality images of the retina of a person with diabetes in a few minutes, and a diagnosis then made autonomously in a few seconds. And so what you have is within 5 minutes, you have this diagnosis. It involves taking flash images of the retina. It typically doesn't require pupil dilation, so it's really patient friendly. We try to make it as patient friendly as possible. And so to make that possible was a long road, because if you say, well, there's so many advantages, right? Improved productivity for physicians. That's the reason for me to found a company. Lower cost of healthcare. That's what we need to do. Productivity is declining rather than going up, and it's just terrible. So lower cost, better quality. It's better than me as a retina specialist in terms of accuracy, and then finally better access. And we talk mostly about that. But to get all these advantages, you have to also solve some problems, and that is that if you talk to people about AI and computers making diagnoses, they start saying a lot of things. I've mentioned glamour AI that is really exciting technologically, but doesn't serve a societal purpose. It's cool, but it doesn't make patients, in this case, better. So does it make patients better? Is it safe for patients? Is there racial and ethnic bias very high on the agenda right now? Will doctors lose their jobs? Who is liable for the errors of the AI? What do I do with the output? How do I prove that patients actually improve? And how are we going to pay for this? So all of that, we essentially had to solve ourselves, because I said to myself, well, here we can do two things. We can go around the healthcare system, or we can work within the healthcare system, be the Uber of the healthcare system, break it, or say, no, we want to work within the healthcare system because there's good things in it. And so we decided to do the latter, meaning we go to the FDA because that's sort of the highest standard in the world of accuracy of medical devices. And we spent 8 years, starting in 2010, working together with them. How do you validate an AI? How do you prove it's safe? And so we needed to solve for the equity problem. How do we make sure it works equally well, is equally accurate, all races and ethnicities? Even though it's on average doing really well, if one group has a really poor performance, that's just not acceptable. It needs to work for everyone in the US and in the world. So how do we test it? How we design? I mean, there's different ways you can design AIs and machine learning. And we decided to take an approach that mimics what doctors do, what the brains of doctors already, as far as we know, do. So that's where neuroscience came in very, very handily. And so we needed to solve that. And then we went through clinical trial design and how do you compare it? How do you know that the AI is wrong and the doctor is right when you compare the two? And we decided, rather than look at what doctors do, because I and my colleagues differ in about 30% of cases, even my well-trusted colleagues here around me. So rather than compare it to clinicians, we decided to compare it to real patient outcome. That's ultimately what this is about. It's about improving outcome. So you want to know how the AI compares to outcome, which is interesting in a chronic disease like diabetic retinopathy, because it takes years to manifest. So you have proxies for that. And I don't want to go into that right now. Anyway, we validated it against outcome, which was very new for AI. No one had done it previously in any field of medicine. So after 8 years of working and designing and figuring all these things out from an ethical perspective, right? The way we describe it to FDA is we look for justice, we look for autonomy, and we look for first do no harm, non-maleficence. And that's sort of the elementary bioethical principles. First do no harm, make sure that you actually improve outcome with the AI, that it doesn't just cost a lot of money. Autonomy means, is it safe for the individual patient? And then justice is, does it work for everyone? Sorry, you're going to interrupt me. Give me.
Well, made me think of Michael.
Sort of ready to interrupt.
Yeah,
so we did a trial. We finished, and a few days later, 30 days later, the FDA said yes. For the first time ever, we will allow an AI that makes a diagnosis by itself to be on the market in the US. So I will stop here before you interrupt me.
I jumped in. I was gonna just build a little bit, Michael, on your point, and some of the things that when we sort of understood the efficacy and the justice component of it. We're in a really interesting moment, obviously, in 2020, and COVID-19 further highlighted the disparities in terms of healthcare and both access, outcomes, et cetera. And then you added into the mix in the last several months of just even further heightening the awareness of that. And so this is a really incredible story that I've absolutely loved taking it at the corporate leading friends of mine that I've worked with over the years to say, it's almost one of those that you come in with slightly too good to be true kind of thing, lower cost, higher quality, and driving, access. I mean, it's got so many aspects to it, but it's so nice to be able to package it in a way that it's also bundled with FDA, FDA approval. So it allows it to anchor it in people's relief on that side. So it's been a really interesting opportunity for me and our team at Fifth Element Group the last couple of months or so to be able to share it with leading business execs across the retail space, the payer space. Frankly, you guys come up. I use Digital Diagnostics as just an interesting story to try to heighten my own interest level for people to talk to me. So I'll throw it out there for whatever reason, but it really is very compelling. I haven't run into anybody yet that hasn't been amazed by it. And a lot of people have no background in AI at all. So a practical application to that, understanding the way that you laid out, makes AI for folks a little bit more approachable and understandable. And they're like, wow, okay, that that actually seems like a really useful in terms of how, so then it gets people excited about other things that Stephen is working on and all these kinds of other areas, because it's an approachable case that they can see actual application for it.
Yeah, and Robert, I think it's really important from a replication standpoint in other areas, the work that Michael has done, because the scientific and technical challenges are real. He accomplished those first, but then he also was able to overcome the other obstacles, if you will, to broad-based acceptance, deployment, and utilization, which have more to do with the social and institutional structures that exist. And as Michael said, they chose to go to operate within the healthcare system because of its many benefits and the path that could be generated to allow for broad adoption, both from the standpoint of diagnostic codes, reimbursement, co-pays, and other aspects that are really required in order for there to be broad-based adoption by the various players in the system. But again, to reinforce, as Michael said, this is an autonomous AI system that can be deployed anywhere, deployed in retail space, in urban malls, in primary care clinics, and really provides for access to critical diagnosis and referral for people in need of early intervention if they're at risk for diabetic retinopathy and therefore at risk of blindness. And I think in that it plays into Stephen's work as well, around it being a model for how you do this in terms of utilize AI, in a model in healthcare, but a model elsewhere, is recognizing the scientific and technical challenges, but also recognizing systems challenges that exist to any of this actually being useful.
Well, you kind of read my mind there, and I was actually going to ask Michael before if he can mimic my brain. He said mimic the brain. I wanted to know if mine can be mimicked and what that actually means. But going to you then, Stephen, from that point, you see a lot of innovations out there. How is this one the same or different? And going back to the point of, a lot of times there's collaborations of technologies that can create even bigger things beyond that. Not to put you on the spot, but what's your thoughts about that?
So your question is in terms of related technologies and innovation that's related to AI, and how this is really a catalyst for similar kinds of technology?
Similar kinds of technologies, maybe collaborations, maybe new things coming from it, things like that, like that.
Well, the interesting work is that this is applying AI to imaging, right? And being able to detect and provide an effective means of early diagnosis and so on. I mean, Robert, or I should say, Michael has already applied this to skin, abnormalities in the skin, but it could be applied to things like imaging lungs, using CT scans or X-rays and so on. So applying AI across all of the imaging sort of technologies that are out there. Interestingly enough, you have ultrasound and sonograms, and usually the resolution, the output isn't quite good enough. Well, there's new kinds of signal processing being applied to those devices. And by the way, you can get a handheld ultrasound sonogram device for about $100 now, and you can apply AI to it. And can you imagine the utility of that? Because that means you can scale it anywhere in the world. But, about 2 years ago, I was asked to speak at South by Southwest, and I actually talked about IDX, which is digital transformation, as being this, global leader and really incentivizing this kind of innovation worldwide. So absolutely, collaboration, scaling, using that as a proof, a use case. Let me give you another example.
Yeah.
AI for Good has spun off a program jointly owned by the World Health Organization and ITU, and it's called the Focus Group AI for Health. And it's actually the application of AI in healthcare and the use in imaging. And in fact, we talk about IDX, or now digital, the digital diagnostic technology, as being sort of a foundational case again, but really applied across every element of healthcare. All the regulatory bodies around the world are involved now. Some of the top research groups around the world are involved as well. And this is about using making it applicable to over 2 billion who are not included in healthcare. So there's this kind of inclusion aspect, who don't have ready access. Well, what's being talked about here allows everybody in the world to have some kind of really high quality care.
Yeah, that's something is really interesting to me, and I'd like to maybe get Ed and Michael involved in this. What is happening with this with respect to the global possibilities, and Ed, related to all the diverse amount of corporate business leaders that can be interested in what this is? Michael?
Yeah, and so you make a great point. I have two parts to the answer. One is in terms of how we build this up. I already mentioned we wanted to go to the FDA first because it's the highest standard, rather than go to maybe other countries where there's less oversight, regulatory oversight, and try it out there. I thought it was unethical. So I went for the FDA first, and now we have that. We already going to first world countries in Asia and other places, Europe, and working with their regulatory agencies to essentially extend the clinical trial we already did. Separate from that, we always wanted to go into the developing world, but with a safe system that is, as good as it can be. And so I cannot disclose yet. It will be in the press release that's coming out next week. And I'm not sure when this is coming out, but we are working together with a very important international organization, because what I'm interested in the developing world is show that this AI can actually improve healthcare worker productivity. That has never been shown. You would be surprised. AI has actually never been shown to improve productivity. And so, we want to do that, and we have the plan together, and we're actually implementing it in a developing country, which shall remain nameless for a few more days. Sorry about that. But those are the very exciting things to bread. It's so scalable, right? But you want to make sure it's ready for scaling, and it's ready.
Can you just whisper it and we won't tell anybody?
Don't do it. Don't do it. He will tell. He will tell. Well, one of the other things that makes me think of too, Michael and Stephen and Robert, as you're talking about it, just this conversation makes me want to co-create all the other innovations we could do around this. I was like, coming out of this conversation, hey, why don't we use it for A, B, C, D, E? So just by putting it out there now and having that really solid foundation that's been scientifically developed and validated, then allows, once you've done sort of that heavy lifting, to kind of look at through other lenses, if you will, whether it be skin or, Stephen, you're mentioning, what would it look like in terms of lung and different areas like that. And I will say, one of the interesting points, almost every group that we talk to now, not surprisingly, since probably February on, has always raised, no matter what we're talking about in terms of the UN SDGs, we do a lot of work as across a variety of them. And so in that sort of space, we talk to corporates and governments and things like that. But number one, they talk about COVID. So like, okay, what do you got going with COVID? And number two, around the justice related issue. And in some ways, if you even look at it from the healthcare system side, we had thought about, well, how does this potentially help even in terms of dealing with COVID? And one of the thoughts that we came up with was collectively, well, if you don't have a huge number of people, if you can offload the people waiting in waiting rooms, kind of, together in hospitals and things like that are busy actually triaging sick people, that's actually a way to prevent spread as well. If you can kind of touch them in places where they're in a retail environment or what have you anyway. So even things like that, you wouldn't necessarily think that would be, connected with a COVID-19, but it doesn't take very long to uncover other aspects of it, which could be beneficial for dealing with current issues. The other part would as it relates to the, a lot of the leaders on the corporate side, they're spending an enormous amount of money in terms of trying to advance where we're at as a community and as a society in terms of the whole structural setup from a racism standpoint. And oftentimes they don't necessarily know where to apply a dollar to create the highest ROI in terms of the impact side. It's interesting, they bring a system like this in, a digital diagnostics system in, they can literally point to communities to say, look, we brought this in, and 2 years later, there's a significant decrease in people who are blind or going blind because, it specifically be able to point towards something extremely concrete. And I think that's the exciting part for them as well. Once they sort of understand like that's an immediate implication in terms of access to the best in the world. There's something beautiful and sort of poetic about groups that have historically been pushed to the margins now being brought in to a place where they are getting the best of the best as it relates to digital diagnostics in terms of the AI side. And it's certainly the access point. So those are a couple points that when we're having our conversations with a lot of leaders across sectors, it does have impact on things that they're thinking about on COVID as well as the justice side.
To support that for a minute, I mean, this is a Leaders Who Care series, and there's a reason we call it that, because the leaders who care are attracting the best talent. They're also attracting the customers to buy from them, and they're looking for ways to show that they care, not just to show, but that they are making a social impact, because it also helps their business. So I'd love to know from each of you. And you know what? I always say this. My grandparents always used to say with a Kiev accent, they would say, as long as you have your health, that's the most important thing, type of thing. But it wasn't a slogan. It was like, because everything they've gone through, they knew that was the most important thing of all. And that's what Leaders Who Care are about. So I'd love to ask all of you, a couple of minutes each, if you will, what role do you see business leaders who care playing beyond just the financial well-being of their consumers and their talent, the physical and mental well-being, how it's important for them to take care of the physical and mental well-being of their talent, and for that matter, of their customers, if you're talking about putting this in retail. Couple minutes each, max. Robert, you want to start?
Yeah, sure. I think I used the analogy of some of the actions that major retailers undertook in response to COVID in terms of opening up their retail space or their parking lots or otherwise for public screening for COVID and otherwise. Business leaders, in particular in retail, have access to enormous resources from the standpoint of that public gathering resources, where people can gain access to these sorts of technologies. I think that beyond that, I do think that it's a little bit of a reset in terms of frame of mind, and I think the Business Roundtable addressed this year, in asking their CEOs to rethink the first rule of corporate responsibility, which is increase shareholder value, to broaden that to looking at efforts to increase stakeholder value and broaden the definition of what stakeholders meant for a particular industry, a retailer or manufacturer otherwise. Yeah. So I think if we're mindful of who our stakeholders are, the needs in our communities, and the resources we have access to, I think business leaders can think again about how they can contribute to elevating those who are marginalized, and to providing taking a special role, taking special responsibilities in their communities for elevating all of us. And it takes more than that at 30,000 feet. That's why I'm so excited about this whole initiative, what Michael has been able to accomplish with Digital Diagnostics. This is a specific thing that you actually can put out there, you can do, that will have substantial impact on.
Yeah, so that gives, it's like a debate. Since he mentioned your name, Michael, it's your turn to talk. So now you go.
And so I want to start local. I mean, I came to Iowa. It has been, not many of you have probably been to Iowa, but it's been amazing. And the people are so welcoming. I came 70 years ago. So the first thing is that I wanted to build this business in Iowa and do something back for the wonderful people of Iowa. So everything starts local. And, I want to have a global impact, and I want the company to have a global impact. And that's, why we're outreaching, and I would love to talk more about AI for good. But specifically to this organization, I have to whisper because, it's just a deal that we weren't going to talk about it today. And so I think by making the right choices in terms of where it's going to have an impact, what your customers are, what you do, and what you don't do in terms of working with validation, working on, how do we organize payment? We didn't talk about that, but there's a big debate, and CMS made the right decision in my view, but there's a big debate how we're going to pay for this. And that is not easy, because if you want to work within the healthcare system, they say simple, well, you can save money because obviously it's highly scalable, but that's in practical matters, that's not how it works. And should we be doing healthcare delivery? So there's all these choices to be made that impact communities and impact society. Again, starting local, starting with ethics, makes it a little bit easier, but we're not done yet, and there's a lot of decisions to be made. But we're a young company, so we don't have all the solutions here.
Well, you started in the right place. That's where the field of dreams is.
Exactly, very close by.
So that's the way to go. So, Stephen.
So let me give you a global perspective. We have, and then I'll give you specific examples. You had 181 CEOs last year. In fact, I'd make it part of my keynote where they went out publicly and said, we're no longer going to prioritize on stakeholder value. It's really about multi-stakeholder community value. And then that was followed by European CEOs this year. So that's kind of one item. Another one is Larry Fink, CEO of BlackRock, the world's largest investment group. And he has publicly come out for the last several years now talking about corporates have to have some kind of impact for them to get support. He talked about climate, and that has to be addressed. He talked about COVID and being socially responsible. He also talked about the world's largest transfer of wealth from baby boomers to millennials of about $24 trillion. And millennials really focus on things like social environment and governance issues. So those are some examples. And then I'll give you some examples of what I'm working on. I'm working with a CEO cluster. It's headed by this great visionary by the name of Doug Wilson. He's the founder and chair of the CEO Leadership Alliance out of Orange County. And he's building an ESG-centric, environmental social governance-centric, social impact-centric AI 360 ecosystem out of Orange County as a center of excellence that can be modeled around the world. So that's one specific example. Another one is YPO, the world's largest group of CEOs, about almost 30,000 of them, represent about $9 trillion in annual revenue. I chair their advisory board, and they have this huge program with working groups and the first largest impact summit, and it's about ESG, things like how do we manage healthcare and disease outbreaks and well-being? How do we manage things like cybersecurity, but refugees, making sure they're fine, and how do we help the economy? How do we address things like hunger and food security and so on? And really focusing on making measurable gains with effective business solutions. So worldwide, there's definitely an interest and a passion with demonstrated solutions to actually do something for good.
Who would have thought? What a crazy idea. Man, oh man. All right, Ed.
As I was thinking about it, it's these kinds of, I'll use your leaders who care, are the people that I want to work with. So I don't care even what, they could be working on anything. And these are the folks that I want to be around. And because the way that they look at it is through a very, what we call an omni-win lens, right? How do I help advance this area in a way that supports what I'm trying to do, but also supports another area? So it's not a zero-sum game. It's a global growth, lift everybody as you go. And for me, that's the exciting part of all this. Now, the practical applications of what they're working on are extraordinary, but it's not the main driver. For me, I look at that, I thought each one of them I would want to be alongside to figure out whatever they're working on. I know where they're arcing towards. So to be able to help, even in a small way, help amplify it in the different areas that I've been fortunate enough to be in, that's the joy for me. And then we iterate and we work on all kinds of different things together. So yeah, no, it's been a joy to be on the call with, geez, what an incredible group.
Yeah, I think we got like a, what is it, a quintet? Is that 5, a quintet? A quintet of leaders who care. And yeah, I'm honored to know you all and work together with you. And I think there's going to be some eye-opening vision happening in the near future and long-term future. So thank you all for participating.
Thank you. Have a great weekend.